Good morning and welcome to the Genesis Care Centre. The Genesis Care Centre is a non-profit healthcare facility situated on the lower south coast in the Kwazulu Natal province of South Africa. We are a 40-bed step-down centre for patients suffering with HIV and AIDS, TB, diabetes, cancer, a stroke or another chronic illness. In the early 2000s, the HIV epidemic was spreading rapidly through our community. In 2005, in KwaZulu-Natal alone, 1.5 million people were infected with HIV. The Genesis Care Centre was founded and was opened in March of 2005. Our ultimate goal is to meet the holistic needs of each individual patient: medical, physical, emotional, social, and spiritual needs. We are privileged to provide a service which not only alleviates the burden from our local government hospitals, but also provides at no cost a safe and comfortable place for patients to come to either recuperate and go home to their families, or to pass away with the dignity and love that every single human being deserves. Every year, we have the privilege of hosting international and national teams. However, due to the outbreak of the COVID-19 pandemic, we don't have that privilege this year of hosting any visitors. And so we would like to bring a tour of the care centre into the comfort of your very own home. Please join us as we see what's been happening at the care centre this year. Let's head down to our admin block and speak with Dr. Gilpin. Dr. Terry Gilpin was a pioneer of the medical community. He has been a part of the Genesis Care Centre since its inception. He now serves as our volunteer medical supervisor.
Well, HIV and TB are both prevalent in our community here and have been for a number of years. The kind of community with which we are working here, underprivileged people living close together, exposed to a number of other diseases as well. Genesis was set up at the beginning to deal with people who have got the HIV or TB, and they have been diagnosed in the hospital sends them home is not able to cope, and so this gap between hospital and home is really a bridge that they can't cross. And Genesis was set up at the beginning to provide a place where people could come from hospital to Genesis and then on to home. And as time has gone on, so Genesis has taken other cases like strokes and cancer cases and so on, anywhere where people need a break between hospital and home, and Genesis then fills a tremendous need in that respect.
Let's go and speak with Sharon Jones, our operations manager, to find out what the heart of the care centre truly is.
From the inception of the Genesis Care Centre, the heart of the care centre has been the hope that we offer to those that are less fortunate, to those that are rejected by society. The care centre is a place where people are treated with dignity and respect. Every human being deserves to be treated like that. Throughout the years, we've seen the most incredible miracles take place, where people have been admitted to the care centre for various reasons and have come in so hopeless that they don't even want to live. And through the work, the love, the care, the treatment that they've received, people find purpose, they find hope again. We have had so many incredible stories over the years. One of my favorites is a gentleman who came in here a short while back, and he came into the reception area. He was dressed in a suit and really smart, so I'd asked him how I could help him. And he said, didn't I remember him? In 2009, he was admitted here with AIDS to die. And through the care that he received, he got strong enough, well enough, was educated on HIV and AIDS and the lifestyle he needs to live. And today he was married, had 2 children, and managed a furniture store in Port Shepstone. He was so grateful, and he just felt he wanted to come and say thank you that day. The exciting thing was that we were able to take him into the wards to share his story with the patients that were in the beds. His story was way more powerful than just our education when we ourselves had not been in that bed.
Here at the care centre, good nutrition is vitally important to our patients who are already immune compromised. And so we grow our own vegetables, not only to save costs, but also to offer the most nutritional meals that we can possibly give. With the expertise of a local volunteer, our staff managed to keep the gardens looking good and the vegetables healthy. This gives our kitchen staff the resources to make nutritious meals 3 times a day, which include protein and vegetables. Here at the care centre, we have 2 rehab assistants who do the beadwork program as well as rehab exercises with the patients. Let's hear from them now.
We help people for physio. We have been helping people come here with they can't walk, they got strokes, they've been met accidents and all that. So we bring them here in this room, then we make them that they can get strength so they can go home. When they go home, they can come to wake up, make themselves to wake up, they can feed themselves, they can help themselves.
From that exercises, we just see how can they do with the beadwork. We start them with doing like bangles. As you know, sometimes our patients, they don't have strength to work in 2 hands. 1 hand is working, but if we start them with doing the bangles, is easier. That is helping them. They can carry on, do the beadwork at home, so they can just put bread on the table. We do lots of in this room, painting, not only painting flowers, so they can gain that strength to be independent again.
But because of the COVID-19 now, we're really down and we need so much help. That we can get help to help people, because people are suffering out there and they need us.
With the outbreak of the COVID-19 pandemic, it was essential that we became compliant not only with our local Department of Health, but also with the World Health Organization. As such, we have added new procedures to our already strict hygiene control. Let's hear from Matron Morrison to find out how COVID-19 has changed our daily routine.
We are adhering to social distancing, so each patient is a bed in between. Every staff member, it's compulsory for them to wear a mask every day. So we're also doing a screening every day in the wards to see if the patients are presenting with any symptoms. Why all these preventative measures are taken, social distancing, in order is to protect our patients, to protect the staff also from being infected.
Because of the national lockdown procedures, the care centre had to stop all family visitation. This has been very difficult for our patients. Let's hear more about this from our psychosocial manager, Penny Gwakela.
The challenges that we are facing with COVID-19 is that the family member cannot just come here, and even if they do come, they are unable to see their family members. And the patients are keeping on asking what's happening with their family members because they don't see them visiting. And since they are sick, they're not 100%, so some of them, they don't quite understand what are we talking about when we're telling them about the COVID-19. As we are a care center, the patients come here, they sick, some of them they pass away, and then as counselor we need to do the bereavement counseling. So it's not an easy thing to do the bereavement counseling over the phone to someone who has lost somebody whom he loves or she loves, and he hasn't seen her for maybe quite a time.
Finding the funds to run our facility has been a challenge, even more so now in a worldwide pandemic. Beverly Nell, our finance manager, has more to say on this topic.
The COVID-19 national lockdown and the resulting economic slowdown has affected every aspect of the South African society, including the funding for NGOs. This situation makes the care centre vulnerable, and we are already experiencing a decrease in funding. We are, however, operating and continue to provide excellent nursing care to all our patients. The Department of Health gives the care centre 42% of our funding, and the other 58% is funded for by ourselves. We hope that our funders will continue to support the work that we are doing here at the care centre in the future.
I asked Sharon what motivates her and her team to continue doing this incredibly difficult work that they do.
Another favourite story of mine is of a young woman who'd been admitted into the female ward. She'd been badly abused. She felt so valueless and worthless that she wouldn't even she wouldn't connect with us. She would hide her face when we spoke with her. For the first 2 weeks that she was here, we just loved on her, we nursed her, we fed her, we bathed her. And after 2 weeks, our counsellor asked her if she'd like to join our bead class. She eventually started to thread a piece of string with some beads. When she'd finished threading that string, the volunteer took the string and she put a clasp on it. And she showed the patient what she had made. When that patient saw the beauty of her necklace, her face lit up. And she said, I made that. I'm not nothing. I am somebody. And that day, her heart started to heal. Her spirit started to be revived. By the time she was discharged from the care centre, not only was she the best beader we'd ever had, but she was also a whole woman. She was someone who had the skills and the tools with which to go back into her community to live a fulfilled life. So many stories like that, which encourage us to continue doing the work that we have been privileged to be part of for the past 15 years.
Although you cannot be here physically with us, we would really appreciate you joining with us, either in prayer for the work that we do here, or by donating financially towards our operating costs, food costs, or medical supplies. Join us.
Join us. Join us.
Join us.
Join us.
Wherever you are in the world, however you choose to support us, together we can make a difference.